Good morning. Welcome, everyone. I'm Amber Salzer. I use she, her pronouns, and I'm the Family Preservation Services Manager. Good to see you all today. We're going to start this morning with some information that Caitlin Thompson is going to share with us. Caitlin, I'll let you introduce yourself and I'll hand it over. Go ahead, Caitlin.
Good morning, everyone. I won't take too much of your time, but my name is Caitlin Thompson. I am a member of the Family First team here at DCYF. And I just wanted to share a really exciting opportunity and invite you all to this. So I don't know how many of you are familiar with the Family First Prevention Services Act. It's okay if you're not. But for those who aren't familiar, it is a piece of federal legislation. I won't get too in the weeds with it. But basically, it allows states to fund prevention services, so services to prevent children from being removed from their homes. And as a part of this work, the Family First team is actually going to host several in-person public events that will provide an opportunity for state and local government, tribes, service providers, and the community at large to participate in some planning. We have to create a new prevention plan, which is the plan that we submit to the federal government that sort of lays out how we do this prevention work. And we really want to have as much community involved in that planning as possible. And so we are hosting these events, actually two different events. They're called collaborative forums. At these forums, we're going to provide an overview of what Family First is. We're going to give updates on kind of status of Family First implementation, do kind of an overview, and then really at our core, we were going to host a lot of small group discussions and activities that'll help sort of build this plan and get people's input into this plan. Those forums are going to be kind of a pretty much all-day affair. They'll be from 9 a.m. to 4 p.m. We're hosting 6 of them, so one in every region across Washington. I will share with you that information about which ones and where in just a sec. Actually, Amber, would you be able to give me sharing abilities just for like a second? Yeah, okay. So if that is kind of too much time commitment for you, we are also hosting what we're calling town halls. Those are going to be much shorter. They'll be like 90 minutes. They're going to be in the evenings from like 6 to 7:30. We're hosting 4 of those. Those are going to be, you'll still hear about the same things, Family First. You'll be able to give your input. We just won't be doing as many activities and small group sessions. But if you just want to kind of come and learn more and maybe give a little feedback, the town halls are a good option for you too. So I'm going to just try to quickly share this, which hopefully y'all can see. These are going to be, I'm going to make this a little smaller, so hopefully we can get it all in one page. There we go. These are going to be in the fall, so mostly kind of September, October. You see we have several of these, the in-persons on the left, the virtuals on the right. So we have them kind of located all over. I am going to drop 2 things in the chat really quickly. One is the link to registration. If you click on that link, there'll be on the left side of the registration form all the information that you need to know about these events. And there'll also be a form you can fill out to register. I'm also going to drop our email in the chat too, in case you're like, I don't understand what she's talking about, but I want to know more. Feel free to email us with any kind of questions or thoughts you might have. Oh, thank you, Marie. Thank you for catching my spelling typo. I appreciate it. So yes, feel free to reach out. You can also reach out, but our email address is probably the best way. So that was it for me.
Thanks so much, Caitlin. Appreciate you being here and sharing. So now I will turn it over to Jeremy with the Public Consulting Group to move forward with our presentation today. Thanks, Jeremy. And thanks, Caitlin.
All right, thank you, Amber. All right, good morning, everybody. Like Amber said, my name is Jeremy. I'm Jeremy Thomas. I work for Public Consulting Group. I did have a history working with Department of Children, Youth, and Families, which is why I am so excited to be able to work on this project with this team. The DCYF team never fail to really inspire me and help me understand more about how these services work. And I was really excited to be able to help with this project. So let's go to the agenda real quick. So what we'll do is we will go through the maintenance level update, define it, explain again kind of what it is and why we were able to do what we did versus what we didn't do on this project. We'll then talk about rate methodology. I'm always super excited to get in and talk about nerdy data components and how they operate and how they work, especially under these contexts where, spoiler alert, the rates are going up so significantly. It makes my job really easy. So I'm always super excited to be able to pitch those rates. And then we'll pitch it back over to DCYF to talk about next steps. I know that DCYF and my team is keeping an eye on the chat. I will try to kind of a little bit, but for the most part, I think we're going to go through all of the slides. We're going to explain all the pieces of what we're working on today, and then come back to any questions at the end so that DCYF and our team can both kind of field them together because a lot of the questions I'm sure will be DCYF oriented anyway. So we'll save those all till the end. So let's move on to the next slide. Okay. So again, we talked about this a little bit, so I want to make sure we're discussing this. And what is a maintenance level update, right? So this is a term that's technically in operation from a budgetary perspective and from a state government perspective. And we're putting some terms around that to make sure that we were meeting the needs as appropriate. So a maintenance level update to rate setting includes changes to model elements that have rapidly changing components. Those are things like salary, insurance, other inflationary impacted items, things that move really rapidly. The state recognizes that there is some process or mechanism needed to be able to realign or correct various assumptions in a model to make sure that the rates are operating effectively. Some examples of some changes that might happen in the model that aren't necessarily like wages could be something like a double counted or a miscalculated element that needs to be corrected for the validity of the model. Updates should all be driven by the established federal or state sets. This is basically saying there's an objective component or data that has been identified to increase or decrease or change rates based off of XYZ. So what do we use primarily for this update? We use the Bureau of Labor Statistics wages. That's the main component. We'll go over what those are and how they look in a few moments. Another major update was the researched operational costs. So prior, PCG had developed operational costs based off of the data report that we collected in 2021. These have been researched and updated to basically create more consistency in rate modeling across DCYF. And then updated the DCYF benefits to make sure that they are in alignment with the best practices within the state. So then we'll move on to what a maintenance level update is not. So we are not including policy or structural changes to the model. So this means workload assumptions. When we went through and we did an evaluation in 2021, that was the mechanism. That was an actual rate update, a policy update to calculate the time it takes to accomplish the task, the number of FTEs required for that task. Those are all excluded in this. We are not doing any updates to those components. Any efforts that require data collection from providers directly was also not part of a maintenance level update. So this gets a little bit weird. As you can imagine, what a maintenance level is a spectrum, and there's definitely some space in between that we've bridged, but we'll discuss exactly why we think the components that were updated and the components that were left were left. So in addition to the maintenance level update, we decided we were supporting DCYF in converting the models from the public consulting group models that were done in 2021 to a DCYF rate model. So since the last rate update, DCYF has developed a model to bring consistent rate methodology across the agency. So while we are focused today on a very small part of the conversation, specifically combined in-home services, rate methodologies, and something that we're working with many states to do right now, is to create a consistent mechanism or system for evaluating models that will happen in combined in-home, potentially, like BRS in this context, child welfare. So all across these, creating common systems and understandings for how those systems work that would then be able to create a system-wide model. So they're obviously not there yet, but we're continuing to help support that. PCG evaluated and verified that the rate modeling components reflect the contract. They also reflect the costs and the current state of financial systems. So specifically, a few things that were changed, though, were the supervisor caseload ratio, i.e. they don't have it. We included that in the previous model, and we removed that. That helps make the model more expensive. Transportation costs were included previously in the model as an oversight, and those have been removed since there is an avenue for charging transportation costs to the state. And then there is some conversation about education standards that we'll go over here in a few minutes. But there is that discussion going on about how those can be interpreted for the model today. And then obviously the one-time and yearly agency EBP certification costs were removed to align with the model. So overall, the point here is to say there is no change to the expectations of you, the provider community, in this rate setting initiative. And so all transitions or interpretations are simply to make sure that the current practice is in alignment with what they are paying within the rates. So let's talk a little bit about how that methodology and what the actual outcomes are for those rates. So what you see here is a lot of really fun numbers that mean so much to each and every one of you, I'm sure. No, so what we have here is this is the foundational calculations for the direct service worker, which is now the foundation of the rate. So before, PCG would develop a rate that had that calculated based off of a certain time scale. So instead of having a certain time scale as the foundation and then various components moving within those, DCYF chose to go with a model that focuses on a direct service worker, so a per direct service worker cost. Really great model. I'm going to be taking this and using this in other formats for sure. But what this does is this keeps the same components that were developed before. So what you see here is the same calculations of the length of service, right? So how many weeks that policy is, the total model defined service hours, all those are still the same from the previous model. So what we've done is we've taken those and created those as the foundation for the rate and then built everything else around it. All right, next slide. So building around it then means that instead of the staffing ratios being for a certain period of time or a number of families per se, they're based off of per direct service worker. So this basically creates a really clear conversation about how much of a staff time is in relation to your per direct service worker. So this really says our direct service workers will be the focus of these models, and then we'll build everything else around it. So what you'll see here is that you see the executive director and program manager have been split out into identify their own positions so that we can calculate and understand how much that is in the future. PBC QA has been added since that is a requirement of the contract. One of the things that DCYF really wanted to make sure we built in was that time that it takes to do that work. Administrative data support and supervisor ratios are all very, very in line with our current practice and understanding. And then we have the Safe Care Coach, which is at a 1 to 100. I know that's a really big number, but essentially the policy level that we're looking at here and calculating here is that the Safe Care Coach requirement is 1 hour per month. So based off of that calculation and looking at some of the timescales for all the other positions, it essentially aligns to be about 1 to 100. And then again, those direct service workers and home visitor positions are now the base. So those are the foundation of the model. So once we've determined how many hours we need per direct service worker, we've now built all the staff around that, right, by the same ratios. We then had to do a staffing wage conversation. So what you see here is the two categories of the staffing wages. Hold up, there's actually three right now, right? No. So we're going to talk a little bit about this. So essentially, in conversation, we wanted to base this off of the requirements in the contract and really focus on that direct service wage. So right now, there are two components based off of the 2021 model. We have the BABS with 2 years of experience and the BABS with 2 years experience and a counseling certification. Of course, we're aware of the Safe Care Triple P and IY requirement conversation, but in doing that, if we were to change that wage based off of the current status of the non-requirement, we would have to lower those wages below that 61,000 because that's the market wage. So in looking at it and evaluating it with DCYF, there were quite a few conversations about the future of this. I think that DCYF is definitely really excited to have some conversations about the best way forward for this, but for the models and the wages, since the vast majority of people are still paying for somebody with that experience or with the BABS, we're allowed to say, all right, let's just use that foundational explanation, that foundational basis as the wage to make sure that everybody's fully funded to what they're actually doing. And so they can move forward. But again, I think there are going to be some conversations in the future about changing that and making sure that's in alignment and that they're supported to fill those positions. This is the maintenance level update because technically this is what the model said prior to this current update, right? So the 2021 model had these two categories. So we chose to leave it and say, let's support the providers instead of going and lowering any wages for those three positions. So that was the main change for the operational costs. So we've built those, we've developed the wages, so that creates the model. And then now we got to add on all the other costs that happen here, right? So operational costs, I will say that this is a very good and solid operational cost, especially compared to what the model was prior. There are a lot of different ways you can take into account all of these components, but we are very rarely seeing HR payroll, cloud services, accounting costs in that same level. These are very, very, very generous. So especially the general operations for unanticipated costs. This is something I'm trying to convince many states to include. There are so many different ways to think about unanticipated costs. Some states are deeply opposed to including this, so I was really excited to be able to put this in. What this unanticipated cost is an additional 5% on the whole model to boost it up and say, there's going to be things that are happening. Now, I think it would be really helpful in the future when DCYF decides to go back and do a policy level update and collect data. If you all in the coming months and years want to collect how many other unanticipated costs are happening so that when we or somebody else or the agency comes to you and asks for those, you have them ready to go so that if that's actually higher, like if it's 7 or 10%, that they have all the information they need to be able to pull these up. The other aspect here to consider is not just in general operations, I use that as an example, but all of these components can be updated now because they're being identified specifically. This is what DCYF moves away from what PCG did in 2021. When we came and did this study, we looked at what the total operational costs were, and we had that as a line item in the budget, but there wasn't this much precision. And so by providing this precision, DCYF is providing the opportunity to have conversations in the future about how much each of these elements cost so that they're really clear in the model and so that we or DCYF can now update those rates in the future. In addition to operational costs, DCYF has some significant increases to tax and fringe. So the taxes and fringe here are pretty generous. We look at the federal taxes and payroll taxes at 27% combined. The federal tax really is only on the 5% net revenue, but you have that kind of that taxing being represented and paid for and fulfilled within the model. Washington B&O tax being represented as well. pretty good. The PTO and holidays at 208 hours is standard, and the healthcare, dental, and vision was well researched by DCYF's partners at Western. We took the data that Western provided and were unable to find anything that was more comprehensive that addresses this. Of course, there are going to be times when providers do more than this, and I think that's really important to have that conversation if you are doing more than this, so that the state can understand why and potentially build that into future mechanisms. But for now, this allows the opportunity for you to say, oh, well, actually, I have this. This is different. And so you can send them the data. Again, the more data that they have, the more conversations they have about this, the better positioned they are to go to the legislature and request those changes when they next update the model with a full policy update. All right, so what does this actually do to the model? What are the actual impacts? So high-level impacts are, your takeaways here are that wages are increased to align with market changes, which is really cool. Funding for benefits are increased by about 25% relative to what we had calculated in 2021. So that's a pretty big increase. Taxes and operational costs were increased substantially and more clarity. The added position for PBC and QA shows the staff hours and allows for that to be able to be built into the model. And then funded management and executive positions separately, really split those out so that as we're having conversation about the need for those positions and having those ratio conversations, there's a little bit more precision in that conversation instead of just saying executive or management, because being able to identify the difference between a CEO, like that top level kind of admin side, versus the people who are on the ground doing the work like a program manager is really helpful in having those conversations. So let's go to the actual rates, which is what you all came for. All right, so while you are all quickly screenshotting or noting these down to getting ready to send them out, I want to make sure I reference that we're going to discuss FPS here in another slide in a second. So I do want to recognize that FPS here is different, right? FPS here is calculated on an hourly scale versus a per family scale. So that's why it's a very small number. Yeah, so you have your 7632 increasing to 8609 at about 13% increase overall. FFT is sitting with a very healthy 30% increase from 3,200 to 4,600. I'm not going to list all the numbers, but essentially as you go down, they all tend to range pretty well. You have Safe Care at 17% and your IY Online and IFPS in the 20s. So these increases happen for all those various reasons we discussed. So you have the increase to wages, you have the change to travel assumptions. Those have bigger impacts in some rates than others. The distinction of some positions and the increase in operational costs all have those factors of increase. I think the main component to take away here is that the increases are dynamic based off of each individual requirements to make sure that we are aligning with those. We do, so I'm actually going to answer this just because it happens to be in line and I was looking at it. So the question was, do these rates increase annually based on inflation or other factors? So we do have an inflationary factor in the models currently that is inflating them to next year, but there will be some further proposed, sorry, PCG doesn't get to set the rate. So we will propose that DCYF does regular interval increases. But I think given that it was 2021 and 2024 with the previous studies, that is some pretty significant increase timeline given the state of the states. So last slide, we're going to talk a little bit about FPS. So is FPS paid less than evidence-based services? There's some conversation about that, and so we sat down with DCYF to really hash this out so that we could inform the conversation as best we can. My goal is to provide as much information for the conversation going forward as possible. So when looking at the costs overall, it's important to think about the difference between the per family cost and the hourly cost. So having two different pieces being compared with different model mechanisms is always difficult. So to do basis for this, I think it's worth looking at what it is per FTE between these two. So an FPS model per FTE, so per full-time equivalency of worker at that therapist level, you're getting about $179,000. So for FFT, for example, in this comparison, for that full FTE for 1 year, all that rate components are coming together to pay about $168.48 per FTE per year. So you can see that that FPS total, when you look at it from the annual and the aggregate, is actually higher per FTE. So what happens is you have these two different billing mechanisms that go down each side based off of each program. So for FPS, you're able to bill family research and session prep. Granted, that is a 2-hour limit. Counseling services, case-related activities, engagement, documentation, and DCYF family meetings. So all of those are paid based off of the hours worked, whereas FFT, for all the hours and the things they have to do, are paid a case rate. Now, generally, now this isn't true for everywhere, but generally a case rate when looking at other states and how they build their models is more generous than a per hour. Just because states are so focused on wanting to make sure that a case rate is fully covering the case, they tend to go a little bit over and help pad those cases a little bit. Now, I'm not saying that's happening here, but I'm just saying that can tend to happen. So it is worth keeping in conversation about how you develop those rates and how you compare them in conversation and policy. I think it is definitely, I think DCYF, from my conversations with them, is prepared to start discussing the best way to move forward about whether the best pace forward is to do FPS onto a case rate or to move FFT and all the others to an hourly rate. I'm sure there are positions on both sides. And again, I look forward to seeing what the work happens here, but I definitely do think that it is in the best interest of DCYF. We as PCG do think that it is in the best interest of DCYF to have a consistent payment methodology amongst all of the services. So as that's developed and that conversation continues, there will be some pieces there. But that is the rate update. I'm going to pass it off to Amber to do next steps, and then we can answer some questions.
Thanks, Jeremy. So our biggest next step is decision package submission. So we're going to submit a decision package that includes requesting funding to implement these proposed rate increases that Jeremy has discussed today. In order to do that, it is, of course, dependent on us getting the funding from the legislature. So that's our short-term next step. For long-term, it will be to update the models as policies change, realizing that this maintenance level update did exclude those policy changes. We know that there are a lot of questions around and considerations around what policies may change in the future, and we do want to take a look at that in the future. So that's our next steps. I think the short term is probably the most important for all of us, and that's what we're working towards right now. So that's what I have for next steps, and like Jeremy said, now we'll open it up for questions.
Let's start with the questions in the chat. I'm going to scroll back up to the top. Allison asks, is the cost of living in certain areas taken into consideration, like a regional area?
We do not have regional variance included in this current model. So generally what we have seen is that with areas and states that have high cost regions, they tend to bring up the average and provide full opportunities. We think that this model should cover the cost in King County in specifically based off of the generous interpretations of some of the policies. So there is not a regional rate set, but regional elements were considered in the evaluation of this rate and the sufficiency.
Thanks, Jeremy. All right, next up we've got Sandra. She commented, the reality is that many of us have direct service worker staff at master clinician, or master level clinician. Sorry, the rate does not reflect that. I think that's when we were back on this. I'm going to take us back to this other slide. Forgive my scrolling.
Oh, Sandra has her hand up. Yeah.
Oh, go ahead. Yeah, Sandra. Yeah.
Hi. Thanks for this. I really appreciate and respect all of the hard work that went into this. But there are several concerns that I have. One of those being that many of the providers on this call have staff members that have been with them for many, many years. And many of those staff members are master's level clinicians.
Yep.
So this does not reflect nor does it support the work that we've done to retain very highly qualified staff members, particularly in a time when many providers are leaving this work. So the fact that that is really not reflected in the rate that that we've been able to retain very highly skilled workforce is disappointing. So that's one thing. Additionally, the FPS rate in this model is lower than the rate that we are currently receiving. Currently, as of July 1st, the rate went to $91.58 for direct time. So this is a decrease.
So I will answer the first question, and then I will defer to DCYF to talk about the current stopgap funding that is included for FPS. So as for the requirements, it's always a tricky space to be in when providers have to go above and beyond the requirements of the program to meet the needs of the program. And I think this becomes a conversation with the agency leadership to talk about those requirements, because State of Washington, for example, is unable to pay for services that are not rendered. And so they're very particular about, and I'm saying OFM, right? OFM legislature is very particular about a maintenance level update to pay for something that is not part of the requirements of the program. So I think for those of you that are doing this incredible work of providing a greater standard, could potentially work with the community to develop a proposal for increasing the standard to that level. And then I would believe that the state could potentially pay for that. That's so far outside of my scope of expertise, but I definitely know what pressure DCYF is under to maintain the requirements as the foundation for modeling. But as for the FPS piece,
I'm sorry, I was just making sure I was off mute. So thanks, Jeremy, for the FPS question. I hear you. We sent out a communication last week around the FPS stuff, and it basically said that the rate that started this July was the result of one-time funding. So we were authorized this higher level funding for only 1 year through June of 2025. And this was provided as a temporary bridge until DCYF could update their rate model and submit a decision package. So if the current DP request is approved by the ledge, the new rate would begin in July of 2025. But however, like without any action from the legislature, the funding for the FPS rate does end and the old rate will have to return at that point. So that's where we're at.
Thank you, Amber. All right, next up we've got, do these rates, we talked about inflation. Oh, we have a question. Is CFI included in this rate model? Jeremy, do you want to take that or should we pass that to Amber?
That'll have to go to Amber. Yeah, sorry.
Yeah, so what we discussed was that CFI should increase at the same percentage as FPS.
Sorry, I forgot about that one.
Jill, we'll jump to you. I see you've got your hand up and then we'll go back to the questions in the chat.
Amber, just so I'm clear, it was one-time funding. And if that's not, if we don't get that money again from the legislature, starting July 1, 2025, we go to $86, which is still a pay cut. Is that what you're saying? Is it we're going to go backwards?
So the one-time funding ends next year, and what we're asking for in the decision package for is the 8609. So that's the request to get that funded moving forward as of July 2025. If that doesn't get funded by the legislature, then it would revert back to the 76.32 an hour.
So when
So-
we were doing our calculations last year and trying to get a rate increase, and we had approved calculations on what we based our rate increase on, it was still higher than this. So, I mean, I don't think you're going to get people jumping into the FPS market at that rate.
Thank you, Joe. Sandra, we'll go to you.
Well, I would just agree with what Jill said. I mean, frankly, I think this is insulting. I appreciate the percentage changes for the other services, but FPS requires a higher level of skill. And as Jill stated, the rate of $91.58 was reflected in what it actually costs to provide FPS service, and also what it costs to retain people who are willing to do that. So I think that the risk with this is that you're going to see providers declining FPS referrals. I mean, there are many providers already who decline FPS referrals because of the rate. So I just think this is inaccurate, and I think it's really short-sighted.
Thank you for sharing your thoughts, Sandra.
Hey, Katie. So,
Oh yeah.
hi everybody. It's Tim. It's good to see everybody. On the FPS rate, so I think there's a opportunity. I think it's a brief one outside of this meeting. I hear the interest in having the ability to understand and unpack a little bit the 8609. As Jeremy referenced, our abilities are really tied tightly to contract requirements. I understand and saw the previous funding suggestion. I do want to clarify, like, that wasn't a strategy necessarily that the department had moved forward or validated. So I think I heard the word endorsed, and it wasn't us doing that. So I just want to make sure there's that kind of clarity in that space. But I think the functional next steps could be in sitting down and looking at the differences. The challenge really for us in this moment is that we are under the direction that this is a maintenance level update. So we're using the standards as they exist within the contract to set the rate. So the opportunity is not so much to reflect what Sandra was saying, like, this work is more, and it requires kind of like more qualifications, like we should move it to masters or license. Like, our window of opportunity is to say, what within the standards of the contract did we miss something? Did we miss it the first time, or are we misrating it this time, right? There's just that. But then I think there is that broader work, and even back in my day, and I hear Delton and Amber talk about it a bit, is that FPS needs kind of some programmatic or policy level evaluations about what is it doing and how is it working. As you know, Jeremy and Amber identified at the top of this project for right now for this DP cycle is focused on just a maintenance level update. I hope that information helps, and the opportunity window is kind of identified a bit.
Thank you, Tim. That's helpful. All right, we're going to jump around. I know I said we'd go back to the questions, but I saw some hands shoot up. So Charlotte, I think you might be next.
Thank you. Can you hear me?
Yes, go ahead.
Oh, good. All right. I think Tim is correct that when I think of what needs to happen with FPS, that much of what we tried to communicate last session was that the policy level changes are probably what needs to be happening. And we have time to try to do something about that before the legislative session, so we know whether to be having to do a pushback against the FPS there. But I'm hoping, Tim, that we'll kind of light a fire under trying to get onto that policy level analysis, and then that's where I think we'll see some rate change summaries. There were just things in the original model, things that got, for instance, left out or anyway, so I agree with that. Let's do it.
Thank you,
Thanks.
Charlotte. Esther.
I think Charlotte and Tim articulated what I wanted to say as far as I think this is a policy issue, and that's what needs to be changed so that we're actually putting in the pay actually
Mhm.
fits the work that we're doing. And so it looks like it's backwards right now. And so I think if we address the other issue, then we can, then hopefully it will address the pay.
Thank you, Esther. Jill, you've got your hand back up. You are muted, Jill, if you are talking.
Oops, no, it's an accident.
Oh, there you go. Oh, your hand was an accident? Okay. Troy, go ahead.
My question is, do all of these rates revert back to the 2021 model if legislation is not passed? Okay, all right, okay.
Yeah, that is my understanding. Yeah, this is contingent on legislative funding.
All right, I saw a question in the chat. Oh, go ahead, Troy. Let me cut you
I
off.
think just one last thing here is it's hard to hire someone into the everything below FPS because they have to be coming in with all of the department trainings in these. And like our entry into this model is really contingent on finding and training FPS providers. Because when people leave here, they leave with all the training they had. Say we had a triple P provider or a PCIT provider. When they step away, we've lost everything that goes with that. So the retention rate at the FPS level, that's like the entry point into providing all of these services. Unless that provider who's trained in triple P or PCIT goes to some other organization that's contracting and they're doing that work, this is like a permanent loss. So the FPS is the only way to get people trained into this field and then have a hope that they then graduate and get some kind of funding or scholarship and the training to do these other things. And so we're looking at years of commitment to attain anyone that, to retain people. So I just want to say, kind of say when the policy level comes around, if people aren't trained in FPS, they're definitely not doing any of these other things probably, I don't know how do organizations obtain people trained in these without like getting them an FPS first?
So this is, I'm gonna chime in. Sorry, Amber, I'm gonna interrupt. But Tori, I think this is something that states are grappling with in all of the clinical service spaces. I was just at Human Services Financial Officers Conference, brilliant ideas coming across the country of people who are trying to think through how to pipeline specific positions, because everywhere they're having problems with people getting trained, getting their quals, and then jumping off to private or some other higher paying service industry. And so I think it's something that we can definitely, there's some good ideas around, and I'm sure DCYF will seek out some of those insights as they're thinking through the policy update that seems to be really exciting to this group.
Greatly appreciated. Yeah, thank you. Thank you so much. Yeah.
Amber, go ahead.
Thanks, Jeremy, and thank you, Troy, and everyone else who's shared their thoughts about this. I just want to iterate that DCYF is committed to engaging in policy change discussions around this, and I'm committed to doing that. So this is not something that we're going to take lightly, and we hear you. So I just want to make sure I'm verbalizing our commitment to doing that.
Thank you, Amber. I see in the chat, it was a little while ago, but there was a request to expand on the 2-hour limit, I think on, oh, I went too far. No, on this slide here. Can we speak to that? Jeremy, is that a question for you or is that a question for Amber?
It's got to be a
probably?
DCYF question. Sorry,
Yeah,
I don't have that information.
It looks like there's a 2-hour limit on family research and session prep. Amber or Delton, can you speak to that?
try and take this one, I guess. So for the EVPs, there is a structured curriculum that you are preparing for your session, which gives that gives a structure for how much time is spent or could be anticipated to be spent in preparation for your upcoming session. Because we don't have that structured curriculum for FPS, we went with 2 hours as a base. Tim, want to make sure I got that right.
Yeah,
Hi there.
So, I'm sorry. Please go ahead. Yeah.
Go ahead, Tim.
So the family research and prep is a element within the FPS model. I think it's a foundational part of also the EVP. So I think what you said is relatively close. We didn't model into the case rates the family research and prep, but it is a billable within FPS. It's an assumed part of case rate. So, right, getting to know the family, reading the files, and then making contact. I was just pulling up the fee table to verify beforehand, but I believe that that is where FPS limits it to 2 hours. I think this is pretty in the weeds also, and I think there'd be an opportunity, like as part of this ongoing FPS policy work, and I think there was another comment in the chat about total billables. I know, Delton, that's something that you have put on my work list as something to partner with you on how to develop like a billing guide sheet. I've heard that, and it's on the list, and something maybe that I could add this question to that as we start to. Good, I see the thumbs up. Then I'll stop.
Thanks, Tim. Luke, go ahead. Do you have any other thoughts on that?
Yeah, sorry. This is Shannon Southall. I'm on my son's
okay.
on my iPad.
Okay, I thought you said. Okay, go ahead.
Yeah, no, I apologize. It's terribly confusing. I just am disappointed to not see anything in here that I think since July 1st of 2023, there's been a real change in the client population and the services we're expected to provide with families that are really struggling with substance abuse and domestic violence and mental health. And I think the needs have really overall increased because there's much less of children being removed. So then we're having unreliable clients with really difficult to engage sometimes, taking several weeks, no shows, rescheduled, cancellations, and there's not any space that I'm aware of in the contract that allows for people to be paid for their time besides this 15 minutes of extra travel time. And I have 2 providers that have to pay for childcare while they work. And so if you have a no-show and then people don't show up, it really impacts them. And I understand in the family time contract, there is policies that allow for reimbursement when clients don't show up. And I really would like to advocate and request this is really considered for FPS and also EVPs because it's people's time. And if there's nothing in place for that, it makes it really difficult. I mean, I have one provider that's had 4 cancellations this week and so therefore doesn't earn any money. And so I really think that needs to be a part of it. And then some guidance on agency cancellation policies that's separate would be helpful. But I really think some funding that allows, aside from this 2-hour prep time, to cover these cancellations, which happen often. Thank you.
Thank you. You had another question, Shannon. Do we have percentages of how often FPS is used compared to other services? With the education requirements for FPS and this being the main service used, why is there not more focus on increasing and maintaining funding for FPS? So Amber or Delton, do you have statistics on the usage of FPS compared to other services? Is that something we monitor or can look into?
So the most recent data I have in my brain is from 2022, and it was approximately 48% of services of our combined income services were FPS. Okay. That's what was delivered to families. I did not say that well, but I hope that means sense. Of all combined income service delivery to families, FPS accounted for 48% of them.
Okay. Thank you, Amber. And message received, Shannon, on your comment there. Is there a way, next up, is there a way to address the length of service for providers? Hiring and training is so expensive. I think it's important to retain staff. Allison, can you expand on that a little bit? Allison Bowen.
Yes, you want to keep employees, right? That's what everybody wants because you want to build on their knowledge and their acceptance in the community and all of that. And I'm wondering if there's a way to some kind of acknowledge when people have been there longer. How does that get played in? Because their salary is going to go up because they're going to ask for it, or your company already has something when somebody reaches a milestone that they go up. And I don't see any reflection in that, which kind of ties into the people that speak a second language. Is there a way to look at that? I mean, there's just a few. I know we have to have like a baseline, but it feels almost like there needs to be a second tier of looking at wages based on special factors or something. I don't know.
That's helpful, Allison. Thank you. Jeremy, Amber, Dalton, thoughts on that?
I know I'm not one of those three.
Oh, Tim.
But,
or Tim. Tim, go ahead.
I want to go back and start at the top of the thing. So Shannon had asked about the certification cost. If you can go back 2 slides, I believe. I want to point something out. One more. Oh, the summary tab, whatever that was. Sorry.
Oh, sorry. Okay.
No, the wages tab. Holy moly.
Oh.
Where was the wages? Right there.
Yeah.
So DCYF uses what we call enhancements, so wage enhancements under certain circumstances. And one circumstance of that is a counseling certification. So the base salary for both of these, right, are both basically 6 years, education with 2 years work experience. And so the base salary for that is $61,555. DCYF uses a 6% cost enhancement for those positions that require a certification. So we're paying, I think it's like $3,600. I'm not great on in the moment math. So supplemental, right, reflecting in part like some of the cost associated with certification, though that can vary widely if you're independently or doing it as an agency affiliated. So it's hard to get to direct hard costs. So I wanted to address that one. The next one that I think I could start to talk about is the retention issue that Alice brought up, and I think it is a real thing. We continue to look for partners to talk about it, to think about it, to actualize it. It gets tough, right? Just to share a little bit of context about the conversations that have happened so far is like, how do you model that? How do you set up like contract expectations for retention and supporting retention? And then what happens when an agency, because like if you had a nefarious agency that wanted to make money, they would just keep a bunch of short-time staff and all of this retention dollars would go there, right? I mean, these are the kinds of questions we get. And so we don't have that answer, and we continue to explore for that answer. So if there are people who are interested in like sharing ideas or examples, if they have other funding revenues that factor this in, like please reach out to me. I'm very interested in this topic because it's one that we don't have a clear understanding how to move forward with. And I think the last one was language, and I'm just going to sit back and I don't know if Delton or Amber have anything in that space.
I'll chime in and just like Tim. The policy there's a lot of ways to tackle paying for multiple languages. I think that this should definitely be a part of the conversation for the policy shift. Again, it's a policy decision. It's not a maintenance. It's not necessarily a maintenance level. Although I guess in a more feisty version of myself, I could argue that it could be. But given the state of this project now and how we delineated it, it was not. So I think that this is something that should be highly discussed and is frequently a part of most policy rate updates that we're doing currently. So I would advise for that.
Thank you so much, Jeremy. All right, we've just got a couple of minutes left. I saw a question about the DOH fees, how they are, who put that? Shannon, you put a question about and you have your hand up. So I will just stop talking and Shannon, go ahead and ask your question.
Yeah, I think that Tim kind of touched on that, but I guess I would really encourage you to look at the agency affiliated. I think is pretty rare, and then there's a lot of independent people paying $800 annually, and then it's about $1,500 to get someone up and going. And my comment is just respectfully looking at the staffing wages for a direct service worker with the similar education that, or often more than a DCYF social worker is going to be coming in at. There's a pretty significant salary discrepancy there. And I guess I would just encourage you to consider matching the provider rate reimbursement for the DCYF employees.
Thank you. Troy, you've got your hand up again. Go ahead.
Sorry, I guess my hand never went down.
No, legacy hand.
Okay.
Not a sweat, no worries. All right, we've got some comments in the chat. I want to thank everyone. We're definitely going to read them and discuss them after the call. Does anybody have any other? Caitlin, it looks like you're off mute. Do you have something that you'd like to share? Caitlin Davis?
No, I thought I was muted. Sorry.
Oh, no worries. It's okay. It's all good. All right, so I'm going to take us back to our next step slide, which we already discussed. And then Amber, do you have any other parting words about when we'll reconvene or the next steps, generally speaking, for this group?
Thanks, Katie. I think that we will tentatively have a provider meeting scheduled in September, so we'll get that save the date out. Hopefully it can all come in a package with the recording of this and the notes, if everything aligns, if the stars aligned. Otherwise, I think the only additional parting words I have is to again express our commitment and moving this work forward. And I hear you loud and clear about the policy changes, and I know it's something that we need to look at. I want to thank everyone for being here today and for showing up authentically and expressing what's going on for you and the families we serve. It's really important, and it matters a lot to me. So that's all I have. I don't know if anyone else has additional thoughts, but thank you.
Yeah, that's it. Thank you all sincerely for your time, and I think that's it for now. We'll talk again soon. Thank you.
I'm going to go ahead and close out. So thanks, everyone. Good to see you. And
Amber, can you meet me? Can you call me right after this? Do you have 3 minutes? Okay, bye.
I do. All right, thanks. Bye, everybody.